So some important terms to know when you're thinking about preparing medications that need to be reconstituted. Think about reconstituting medications as making Kool-Aid, because it's a powdered form, right? We're going to call the Kool-Aid powder a solute. Just like the term says on the board, it's a powdered medication, right? It comes in that little package, but you would never eat the Kool-Aid just like that. That would be horrible. We're going to consider that to be unstable at this point as far as nursing and medications go. What we want is a solvent or a diluent, which is the water that we mix the Kool-Aid with. Now it's going to be, we can drink it. Once we dilute that really concentrated or that really strong powder, that's what we're looking for here. It's essentially the same idea. The way that you're going to think about reconstituting medications is first knowing what you need to work with. So here, I've got some options. Okay, what you have in front of you, you see that this is 0.9% sodium chloride. Then you have another option, bacteriostatic water. Please note that these are capped vials, and the way that a cap will come off is you have to just pop it with your thumb. We're going to get into that. Please note the total amount or the volume here. You got 30 mLs of water, 30 mLs of 0.9% normal saline, or also called sodium chloride. Okay. Then there's a little note. Each ml contains simulated sodium chloride. You want to read. Just get in the habit of reading vials when you have them. Then this one is bacteriostatic water. Again, 30 mLs. Okay. That's an important note. So if you're going to be choosing between how you need to dilute your medicine, you have to read the labels. For drug diluent use only. Okay, so we have some options of solvents or dilutants. But now we need to read what the drug manufacturer is telling us to mix it with, or what the pharmacy is telling us. So what comes into mind here is, here's your medicine vial. Now this is a single-use vial. If you read here, it says, so it's a demo dose. It is a powder. Okay, for teaching purposes. Now, it says strength of the prepared solution. Once you prepare this Kool-Aid of medicine, it's going to have 200 milligrams per 1 ml. Okay. Oh, right here. Amount of diluent to be added, 10 mLs. So this vial is telling us, hey, if you want to be able to use me, you need to add 10 mLs. Okay, and normally it'll tell you to on a practice vial, but let's see if it says it. Nope, doesn't say. You might have a separate order that says dilute with normal saline. Or, let me show you another option. Here's another practice vial. Now this one, okay, is another glass vial. Again, the top would pop off when you're ready. But check this out. Practice dosages. Strength of prepared solution. Again, once you add that solvent or diluent to the Kool-Aid, that's prepared. Okay. So once you add whatever you need to dilute this with, which we're going to figure out in just a second. Now, here's your strengths. 300 mLs, 300 milligrams per ml if you dilute it with 9.6 mLs. And right there, in very small red letters, it says to reconstitute, add 0.9% sodium chloride and rotate until dissolved. Which your total volume would then be 10 ml. So if you follow each of the rows, okay, of diluent to make different strengths of the medicine, this is telling you, is your Kool-Aid going to be less sweet or more sweet, essentially. For example, you've got here 300 milligrams per ml if you add 9.6 mLs of normal saline, which will give you a total volume of 10 mLs. Then it's telling you here, you know what? The dose is going to get a little stronger, so that Kool-Aid's going to be a little sweeter, because now it's going to be 400 milligrams per ml if you reconstitute it with 7.1 mLs of normal saline to give you a total volume of 7.5 mLs. Now it's getting really concentrated, or very strong, very sweet on the Kool-Aid side, if you will. 500 milligrams per 1 ml if you reconstitute it with 5.6 mLs of that normal saline, which will give you a volume of 6 mLs. So let's do this one. If we want to make a reconstitution of 300 milligrams per 1 ml, then what are we going to do? We're going to want to add 9.6 mLs of diluent. Let's get started. Let's do that. So are we going to use the bacteriostatic, or are we going to use the sodium chloride like the vial actually said to mix it with? The vial knows best when it comes to mixing reconstituting medicines, because we want to go with what is on the vial. Again, if it's not on the vial, like this one, it is not on the vial, I would either call the doctor or call the pharmacist and ask for the recommendation of what to dilute it with. Honestly, it would probably be pharmacy, okay? So again, if it doesn't say it, please ask, don't just guess. Call your pharmacist. They are going to be your best friends. All right, now let's get started. We don't want the bacteriostatic. We don't like it. All right. So now, how do we draw out of vials? Well, if you guys watch the video on mixing insulins, drawing out of a glass vial doesn't change. What I mean by that is you're going to prepare it like this. You're going to pop each vial and get it together. Utilize your workstation, keep them nice and flat. You are going to clean each vial top with alcohol. Set them aside. Thank you. I'm going to prepare now. Since we're going with the dose of, we want 300 milligrams, we need to add 9.6 mLs. So now I ask you, would you rather have, if I need to add 9.6 mLs of diluent, would you want a 10 ml syringe or a 3 ml syringe? 10 ml. Okay. Now, in some facilities, most facilities will have like a plastic needle instead of a needle. We don't have them in this hospital. So we're going to utilize 2 needles. Pick a size, any size, anything that you're comfortable with. I went ahead and went with an 18 gauge, right? That way nothing's going to get clogged. So now I'm going to aseptically connect this. I'm going to open it. Oops, that's okay. And I'm going to aseptically connect it. Okay. And I'm just going to clean this one since it fell. Okay. Now, I've cleaned both of the tops. Now I want to draw up air. 9.6. 9. And then let me just count. I can't. 2, 4, 6, 8. Okay. So now if you read the calibrations here, you would know that, so this is 9.2, 9.4, 9.6. That plunger needs to be over that third line because it's in counts of, it's calibrated to 2s, essentially. Okay, so I've got 9.6 mLs of air drawn up. I am now going to instill it in the middle of the vial. All right, here's how I do it. Let me just... I'm equalizing the pressure. I'm not touching the plunger. Now watch this. The pressure will draw it out by itself. And as I showed you in previous classes, how to get the bubble out. Okay, I've got to move off camera because I don't have enough hands to work both. 2, 4, 6. Now I've got my solvent, my dilutant. I've got 9.6 mLs of normal saline. Got it. Out with the same needle. .6 mLs. Going right here in the middle of the vial, pressing it down. Now you're going to utilize, see how my hands are? And you're going to push it in. Push it, push it, push it, push it in. It's going to be pressurized. Okay? Now, I'm going to discard this right to the sharps or recap it in a swooping manner because I didn't go into a patient. Let me just clean this top here. I want to make sure that I roll it, not shake it. Oh, wow. All the powder is now dissolved. Now you just made a dose of 300 milligrams per 1 ml because you chose to dilute it with 9.6 mLs of normal saline like it says. Now we have a total volume in this glass vial. You can rotate it like this as well if you need to. Sometimes the powder gets caught in the neck. And now you have a 10 ml dose of, let's say that this is Rocephin. Okay. So now, let me get, see here. Now that we did that, we're ready to draw out. So now it comes down to knowing what your order is. Okay? Again, there's no formula for reconstituting, but, hold on. What does come into play is what your order is for the patient. I'm going to give you an example right now. So let's say that we're going to calculate Rocephin, which is the med that you just made. That's what we're going to say that this is. Okay? Rocephin. If we have an order for 250 milligrams of Rocephin, IV push, Q, or stat. Let's just say stat. Okay. IVP means IV push. Or I might say IV. But anywho. And now your supply is 300 milligrams. Because that's what this says. You made a 300 milligram dose. Okay, so that's, now this is the supply. Order over supply, or desired over have. You see where I'm going with the formula? I'm going to divide that, and we know we're going to times it by the quantity, which is an ml. This is going to cancel, that's going to cancel. You do the math, it's going to equal 0.83 mLs. That's how you would do, if you want to do it like that, an order over supply. Okay, and I'm going to give you another example. So here's another example. So let's say So here's some calculations you can use for Rocephin. Okay, it gives you, coincidentally, what I handed this out to you guys the other day in class. This will match this. Okay. See how it says 300, 400, 500? Then this says 300, 400, 500. Those are just some basic Rocephin calculation examples that you can use when you're reconstituting. Now, let's say that the order is 300 milligrams, a stat order of 300 milligrams. How many mLs would you draw out? Well, the answer is 1. So here's how you're going to do it. You're going to get, for 1 ml, do you want a huge syringe like this one? Or do you want a small syringe like this one, a 3? Yeah, I want a 3. So again, you're going to prepare, you're going to get an alcohol swab, clean it. You're going to aseptically connect it. So like this, I'm not touching either of the hubs. I'm going to draw up air. 1 ml. That's how you draw up 1 ml. See how the plunger? Ooh. Make sure it's equal right on that line. Don't worry about the little triangle in the middle. We're not worried about that. We worry about the even line against the barrel. Meaning this line must be right on the money. Okay, you've got your 1 ml of air drawn up. Now, you're going to go in the center of the vial. You're going to instill your air. Instill your air, equalize that pressure, invert. It's going to do the work for you. I'm not even moving. Okay, now I'm going to have to fix this off camera real quick here because I can't work both hands with one. You're going to have to get air bubbles out, tapping it, holding it steady. Okay. Almost done. Got that. Now, there's your 1 ml. Those small little micro air bubbles, those are okay. Those are micro bubbles. Now you have 1 ml. I'm going to recap my syringe. How? With a swooping method, because we don't walk around with needles open to air. We don't hand other nurses needles open to air. So now what you just did was you did a reconstitution, and the order, I gave you another two examples of orders and how to work them out. This is a straight up example. If you needed 1 ml, the strength. You had an order for 300 milligrams for 1 ml. This is what it looks like. In this syringe is 300 milligrams in 1 ml. Hope you enjoyed the video on medication reconstitution.